So welcome. I see people start joining. I will just leave it a couple of minutes for everybody to join. I'm expecting a few more attendees. So now it's 10 o'clock, but I will just wait 1 or 2 minutes more. I hope everybody has had a nice morning. Here in Denmark, it's a little bit of snow today, actually.
Meaning that you share your weather with friends.
Waiting 1 more minute and then we will start the webinar. So it seems like everybody is here now. So actually I will start by sharing my screen. Hang on 2 minutes. So first of all, good morning to everybody. So good morning, good morgen, hyvä huomenta, and good morning. I'm happy to see we have participants from across the Nordics and do welcome each of you to our webinar on how to implement EUCAST 2021 into the Vitek 2 system. I will just start with a short introduction with some practical information on how the timeline looks like. So starting with some practical topics, you are all automatically muted. There are, however, several ways of asking questions. You can post them into the chat. Please feel free to use local languages. I will understand the Scandinavian languages, and for Finnish, Google will be my friend. You also have the option to raise your hand if you want to speak out. Once you raise your hand, I will just unmute you and you can speak. Probably it will be easier for you to use the chat. And if so, as mentioned, please use local language and the questions will be answered when appropriate during the meeting. Please also be aware the session is recorded and you will be getting a copy of the recording afterwards. To let you know who is who from Biomilieu on this call, I will start by introducing myself. For who that doesn't know me, my name is Tina Alsing. I am the Nordic product manager for microbiology, covering our products, including automated IDAST solutions, such as our Vitek MS Prime, and then of course our Vitek 2 system, which is the topic of today. I will then let the floor to Romuald.
Hello, everybody. I am Romuald Courtade. I'm working in Biomilieu in the regional department for marketing. So I am in charge of the Europe countries supporting their marketing activities. And today I will be your speaker to give you the reminder about EUCAST update 2021.
Thank you, Romuald. And Cécile?
Hello, everybody. My name is Cécile Malenger, and I'm application specialist, especially in Benelux. but now also for you. And I will explain you how you can make the changes in your Vitek software or the PC to be aligned with 2021.
Thank you, Cecile. So here you have today's program. The introduction is, of course, happening at the moment. Then Romuald will give a small reminder, about 30 minutes, what are the new definitions in EUCAST 2021. So he will be talking about the new definition of the intermediate category. He will also talk about the off-scale breakpoints and the area of technical uncertainty. After this, Cecile will have a demo to show you how you can introduce these new guidelines into your Vitek 2 system. And then, of course, we have some time for questions. As I said before, please post your questions in the chat or raise your hand as you prefer. By this, I have concluded my very brief intro and will now give you the floor to Romuald for his presentation on the new guidelines. So I will stop sharing.
We're not sharing, I guess.
Oh, I was not sharing. Ah.
No.
Anyhow, the words was the most important.
But
so it's all yours, Romuald.
And can you see my screen, by the way?
Yes.
Good, perfect. So I'm very glad to introduce to you the EUCAST 2021 updates, knowing that it will not be for you, I guess, a new discovery that you are going to find out here, but just reminders. So let's get started, and I want to cover briefly what will be covered just right after in practice by Cecile. So before starting, I would just like to mention, and this is really important, that all that is going to be said on my side and on Cecile's side will be on behalf of the EUCAST, meaning that you can find all the information there online on the EUCAST website. And what we're going to tell is really not bioMérieux property, but fully EUCAST property. So don't hesitate to find out all you can on the EUCAST website. Let's get started with the version 11 table, waiting for the soon coming version 12 table. But here still we are in 2021 for a few days, so I'm going to speak about the 2021 updates. First of all, as you can find in the version 11 of the table, you've got all the explanation on those tables, and I think it's good to remind that when you are looking at the tables, depending on the family and organism you are looking for, there is a legend which explains that you can find, of course, all the MIC breakpoints, the liquid methods, and as well as the diameter breakpoints for the disk diffusion. Something important that we don't always think about is that when it's blue, there is a hyperlink text, meaning that you can click on it. And for instance, if you click on the diameter zone or on the MIC breakpoints, which are in blue, you will have a link to the MIC distribution that we are going to just have a look right after. By the way, also, it's very interesting to click sometimes on the molecules as well, because you can find all the rational documentation, which is available for the antibiotics with the pharmacodynamics, the Monte Carlo simulation, and all information you may be interested in for the molecule. Then after, you've got, of course, within the breakpoints, we are going to cover, as Tina mentioned, the off-scale breakpoint. So everything which is in yellow, it means that it has been changed for the current version. And here, for instance, you've got for temocillin the example of the off-scale breakpoint of 0.001 that we're going to talk about a little bit. As well, we are going to speak about the area of technical uncertainty, which is mentioned here also on the table. Reminding also that when there are insufficient evidence, you will have the legend with IE, when something is preparation with IP, when it's not applicable NA, and when there is no BP, it means that the AST, of course, is not recommended for that molecule. When there are BPs, breakpoints which are in brackets. It means that it's used to distinguish between wild or with a required resistance mechanism. So it means there is a distinction between those, and this molecule is used for that purpose, and this breakpoint also. And of course, you've got every time, most of the time, with the breakpoints which are in brackets, but also for some others, you've got number for the breakpoint for the MIC breakpoint and letters for the diffusion. And this is important to read them to be comfortable with all the information in the table. And more than words, what I prefer to do is to show you live this EUCAST website, which is a huge website with a lot of information. And I wanted to just to speak again about the epidemiological cutoff and the MIC distribution. So when you go in the EUCAST website, you've got here the content, and in the MIC and zone distribution cutoff, you've got the access to the EUCAST database. This database contains a lot of MIC distribution. You can search in this database by filtering with the antimicrobial or the spaces. And if we do the example of the spaces, you will have here, for instance, let's take the Enterobacter cloacae. When you do so, you've got the access of the MIC distribution for the organism for the different molecules. And for that reason, you've got here in blue what corresponds to the wild type with the number of strains which has been recorded with the different corresponding MIC here. And of course, as you click on it, you will have the MIC distribution in blue with the wild type MIC distribution. And sometimes, depending on the molecule, you can have also the red part of the non-wild type distribution for MICs. And of course, what I wanted to remind is that there is the epidemiological cutoff, which has been set. For instance, here 0.125 for Enterobacter cloacae and cefepime. And as such, you can have a distinction with this epidemiological cutoff. You can have the distinction of the wild type and non-wild type distribution. So this is always good to have a look at that. The EUCAST website contains more than 25,000 MIC distribution. And by the way, I would like to say that in Vitek 2, we are using different sources also to build the advanced expert system. And one of the sources which is used for the wild type recognition of the patterns in Vitek 2 is using, of course, this wild type distribution from the EUCAST. We have, comparing the database, we have 59,000, more than 59,000 MIC distribution in the Vitek 2, due to the fact that we are covering, of course, the wild type phenotype, like the EUCAST, but also the non-wild type phenotypes with the recognition of a lot of resistance mechanisms. So that was the reminder on the ECOF, and this is the slide that explains just what I just showed before. So with all the possible MIC distribution that you can have a look at. So don't hesitate to access this freely available information in the EUCAST search database. As we said, this epidemiological cutoff is making the distinction between wild type and non-wild type. So wild type means absence of acquired or mutational resistance, whereas non-wild type means that there is a presence of an acquired or mutational resistance. And this is a very useful information because first, as you could see, it's based on very large number of MIC distribution from different worldwide worldwide sources, but also it's a way to continuously be updated with the resistance level of the organisms and to have a look at and monitor the resistance drift over the time. So they are very useful for epidemiological reason, but also when there is no breakpoint, it's also useful to have this distribution and distinction of the wild type strains versus the non-wild type strains, depending on their MIC. Of course, here is represented the small breakpoints and the high breakpoints, which correspond to the breakpoints and the threshold that are going to make the categorization for therapeutical reasons, for therapeutical treatment between susceptible, intermediate, and resistant. So this is, of course, obvious to mention that epidemiological cutoff is different from those breakpoints because the breakpoints take into account the therapy and the patient therapy and clinical therapeutical impact, which is not the case of the epidemiological cutoff, which is mainly biological oriented. But of course, with the clinical breakpoints, you're going to report as susceptible or intermediate or resistant based on those two concentrations that can predict the likelihood of success or failure of the treatment. If we go back on the categories, as we learned all in the past, there is 3 categories. There are 3 categories, one susceptible, the other intermediate, and resistant. And in the past, this intermediate category that we were used to was corresponding to different things. It was a kind of in fact, a kind of mix between the uncertain therapeutic effect that we could have from the antimicrobial agent perspective, but it could be also sometimes, it could be used in therapy as there were a concentration of this drug in the body at certain specific body sites, like urine, for example. It's a good example where urine was the antibiotic was concentrated in urine. Even in some intermediate category cases, it could be used in therapy. And it was also a buffer zone preventing, let's say, technical errors or major discrepancies that could appear in the interpretation. So when I learned the susceptibility testing, I learned SI as success, which means susceptible, in fact, with the high likelihood of therapeutic success, or like failure. And at that time, intermediate means I don't know, because of these uncertainties. But now, EUCAST decided to distinguish between the uncertainty and the exposure. So it means that everything which was related to the therapeutic effect or the technical results has been discarded from the intermediate category, focusing only on the physiological concentration and the dosing regimen. So this is important because if we consider again the categories, and you've got here now what is the new definition of the categories, we have susceptible, which means susceptible at the standard dosing regimen with a high probability of therapeutic success using the standard dosing regimen. But now, intermediates, since it has been completely, it's taking only into account the exposure and the therapeutical effect, it means that you've got now in the definition the fact that it's susceptible, but under increased exposure. So this is important to have this in mind because it's not a mix of what we saw just before with the uncertainty and the therapeutical effect, but now really the definition is that you can use the antibiotics with an increased exposure. And that's important because there is a recent publication that mentioned that most of the clinicians are not fully aware of these changes regarding the definition. So it means that potentially they can have still in mind that intermediate could be not be used, whereas here we say clearly that it can be used, or there is a likelihood of therapeutical success, but by changing the dosing regimen to an increased exposure. And resistant means, of course, as before, that there is likelihood of therapeutic failure, whatever the exposure. So that's important to remind us. And I have this in mind in terms of interpretation. And the main key takeaway is that the new definition of those categories, susceptible and susceptible under increased exposure, are designed, in fact, now to help the clinician in the decision-making by only considering the exposure. And as said, it's not any longer a mix of technical and clinical elements consideration. So the importance is that it gives the opportunity to use the intermediate category with the new definition of susceptible under increased exposure to spare the use of broader spectrum antibiotics in a context of antimicrobial stewardship. And now we have a clear separation between the technical uncertainty and the clinical exposure. So that should reflect the fact that you report categories only based on therapeutic and exposure. So that's why it's important to communicate and to take this opportunity to communicate to clinicians this new definition, as the report means now that it's fully and clearly related with the treatment and the exposure of the patient. Let's move now on the area of technical uncertainty. So as we saw that the uncertainties are completely separated from the different categories, there is still some area where there is a technical potential uncertainty. So you can see here that, for instance, with Pitazo, we've got the one for the MIC breakpoints and within the MIC breakpoints table and the zone diameter. Of course, the method is strongly impacting this area of technical uncertainty. So you can notice that you've got some for this diffusion method, and sometimes not for the liquid method. Whatever, it's important to have in mind that this is a warning for the lab as soon as you've got this value for the MIC falling into this area of technical uncertainty. And this is here the table with all the, not all, but the one that are impacting our Vitek 2 card portfolio within the antibiotic that you may be using. So here it's depending, of course, a lot of your panel you are using locally. But if we summarize here for the full Vitek 2 portfolio with the different area of technical uncertainty, you've got the list here of the species or the family and the antibiotics that are concerned by this area of technical uncertainties. So based on that, what we can say is that this area of technical uncertainty, which is MIC's values, in fact, are a range of where the test, if it's correctly performed, means that it cannot be fully interpreted, or it will. It's an area where this is difficult to interpret this value. Why? Because we are exactly at the room where there is unreproducible results, or where the reproducibility interpretation cannot be achieved. So, of course, and it's important to have that in mind, is that it takes into account that you perform correctly the test. If so, it's a warning, and we are going to see what the EUCAST is recommending about this warning. But if there is, of course, a doubt about the test, of course, repeating the test can be one of the actions. Also, something important, which is that the area of technical uncertainty is not a category like the one we saw with the new definition as susceptible, intermediate, or resistance. So it means that it does not interfere with the interpretation of the results. It's, as I said, as EUCAST mentioned, it's only a warning. And it's a warning which is not always easy to manage. Let's discuss and potentially debate. There are some discussion about how to implement this area of technical uncertainty, because it's always uncomfortable to explain to the clinician that you are not fully certain of this value or for these antibiotics. So what can be done, let's say? EUCAST is recommending a few actions. So one of them is perform an alternative test. Again, I would say that if there is a suspicion or a doubt about the test that has correctly been performed, this is probably an alternative to be done. By the way, I would like to mention that now with the Vitek 2, we have the traceability of the McFarland, which can be recorded for each isolate. So this is a good point to have a look at the McFarland value and to see if the McFarland and the standardization of the test was correctly performed. And in this case, you can have potentially an action to be done if the McFarland is not correct. So that's a point which could impact the value. So that's why now you can have a look and correct if necessary. Another possibility mentioned by the EUCAST is that you can report the area of technical uncertainty as uncertain, or leave the interpretation blank, or add an explanation to the report, referring to this area where the results can be difficult to interpret. This is something which is not always easy to do, as the physician is waiting really for reliable results. So reporting uncertain can be sometimes confusing. Reporting the results also from AS to I, from susceptible to intermediate, or from susceptible to resistant, or intermediate to resistant, could be also a way to avoid risk and to take an action which is let's say more or less safer. However, it's important to have a look at the report itself, because when there is only few therapeutic alternatives, changing the category can be sometimes, depending on the strains with multi-drug resistance organism, it can discard some potential alternatives. So it has to be done in a way where there is a lot of choices and there is no potential patient impact. The other one is that you can discuss the results with your clinician when there is only there is a very few therapeutic alternatives, and this was the antibiotic that was planned to be used or what was used. In this case, this is the opportunity to discuss that. And I think this is probably what we should keep in mind for this from this area of technical uncertainty. As first, it's a warning, so it's more for the lab, in fact, to know that here we are falling into an area of technical uncertainty. And the second thing is that it's probably also, as the new definition of the categories, an opportunity really to discuss with your partners and the clinicians about the results you have. Because what is important with the antimicrobial stewardship is the relationship you have and the discussion you generate from the antimicrobial susceptibility testing. And the advice of the microbiologist is key for them. So I guess this is really important for you to discuss all the results, and these results with the new definition and this area of technical uncertainty when you've got some cases. So that was about the technical uncertainties, and let's go now for the off-scale breakpoints. So recently, EUCAST has also arbitrarily set some breakpoints which are as low as 0.001 milligram per liter for certain antibiotic species combinations. So looking at the graph that we were having before, you can see that from 0.001, in fact, it's a way to report systematically intermediate when you are lower than the high concentration. And since the level of the small concentration cannot be reached, you will systematically report susceptible under increased exposure with the off-scale breakpoint. So with this new definition, it means that some antibiotics having off-scale breakpoints will be, when there is no resistance detected, will be used under increased exposure. And if there is a resistance detected, it means that you are not going to probably to use this antibiotic. So the key takeaway about this off-scale breakpoint is that it's really a way to report systematically without resistance detected intermediate with the new definition of susceptible and increased exposure. And as I was showing before the ITU, I am showing here now the 21 antibiotics that are impacted in Vitek 2. Of course, it depends again, like before, about the panel that you are using and the combination that of antibiotics you have in your cards. But you've got here the summary of all the off-scale breakpoints. And the strong advice is that when you implement this off-scale breakpoint, like Cécile is going to show you right after, this is important to keep in mind that when you want to make some changes, if you decide to make these changes of scale breakpoint, it's important to have a consistency within the family of antibiotics when you do it. Within the family, it's rather logical to make the change for all the antibiotic of a family or none if you decide not to implement them. And you will see that in Vitek 2, you've got the full flexibility to implement some warning for the area of technical uncertainty, as well as you will have, and shown by Cécile in a few minutes, you're going to see how to implement this off-scale breakpoint. So it's fully flexible and you can do it the way you want with the Vitek 2. So as a key takeaway, we said that the off-scale breakpoint is intended to make sure that this combination are never reported susceptible with the new definition, means with the standard dosing regimen. And this corresponds to the wild type organism that should be part of this category when no resistance has been detected. And of course, it doesn't mean that you need to test this concentration in vitro, but it means that it is off scale for reporting purposes and not part of testing. So this has been set to imply to include the distinction between susceptible under increased exposure and resistance. So not to be tested, here to be systematically reported as susceptible under increased exposure and never susceptible with the standard regime. This is the main key takeaway. So about Vitek 2 cards now, going in details with what Cécile is going to show you, we would just like to recap that you've got different cards that you are using for gram negative, for gram positive, for streptococci, antifungals as well. Most of the time, depending on the cards you are using, you've got, let's say, between 2 to 5 wells, which contains different concentration of the antibiotics. And the Vitek 2 is going to make a kinetic reading. The advantage of this is that first, with the kinetic reading, we are able to report faster the MICs And we have a lot of questions about the MIC. So that's why I wanted to make a small focus on the MIC. And Vitek 2 is able, from out of what we can see on the market, except if we are using MIC strips or if we are using microgrowth microplates, Vitek 2 is able to report a very large MIC calling range based on the algorithm that Vitek 2 has for each combination of species and antibiotics. So here, for instance, we've got the example of the ceftazidime. The MIC calling range is going, and you can report the MIC from 0.12 to 64. And in the cards, you've got six concentration that is tested. This is where you've got the dots. And of course, around this concentration tested, the Vitek 2 is able to define the MIC in order to give you a broader MIC. And this is important to have in some cases, like for instance, here with the cephalosporin first generation, a very broad MIC calling range for resistance mechanism detection purpose, of course, to cover the breakpoints, as we saw, it makes sense, but also to distinguish wild type from non-wild type phenotypes. So that's why we aim at giving fast the MIC and broader, a broad MIC calling range. And often we have the question about the performance of this MIC. Can that MIC be reported? Can that, are that MIC reliable? So this is here the way that you should have for any kind of commercial system with the publication of the performance. And this is what we are providing to you in each IFU of your cards. You've got the performance published in the IFU. And what I'm going to show you is that these performances are related to the FDA clearance and the FDA regulatory criteria that constrains us to have a certain threshold of performance to implement this molecule in our cards. So for instance, what we do is that we compare the MIC reported by the Vitek 2 with the MIC that we found with the microgrowth dilution. And we do that for many strains, covering many possibilities of resistance, of biological variability. And then we need to reach at least 90% of essential agreement for this MIC between microgrowth dilution, reference method, and Vitek 2. And if we are upper this or equal to 90% of essential agreement, it means that we can insert this antibiotic. On top of that, we are also, as the FDA requires and the ISO standard norms requires, we need also to be less than 1.5 very major errors with the FDA, and with the ISO less than 3% of very major error. So it means that we need to have this in less versus this criteria. It means that we shouldn't report susceptible when it's resistance with the very major errors. And if we are upper of about that, we have a limitation for sure appearing with this potential combination. And we have also same criteria for major errors, as you can see here, less than 3%, and minor errors. So this is important because we do that comparing the reference methods with the essential agreement. We do that also with the breakpoints that are applied and validated on the Vitek 2 with the category agreement, comparing what we find with the microgrowth dilution and the Vitek 2, in order to make sure that you've got the reliability of what you expect with the Vitek 2 cards. And this is the example here of what you can find in the IFU I was mentioning. So you've got the list of the antibiotics you are testing in the card. You've got here the column with the essential agreement, and for each antibiotics, the percentage of essential agreement with the very major error, and minor error. And you've got the same with the category agreement, applying the breakpoints validated. And you've got all the details and all the performance which are published. And you can, of course, refer to that to have confidence with the results you report. And this is important to mention that these performances are regularly updated, and when we do the validation of the new breakpoints, for instance, where we will have the version 12 in January, we are going to do the validation of the breakpoints, and we are going to repeat all these calculations in order for you to provide you with the performance. So stay tuned with the software updates that you receive, because it contains the breakpoint update, plus some customer notification, service notification, which provide you with the validated breakpoints that has been done in between software update, and allow you to implement the new breakpoints versus the very last update of the EUCAST. And we have a strong willingness to accelerate this EUCAST breakpoints update, because we know that it's very important for you. So that's why we can also be in touch, if you want, to compare between 2021 or 2022 soon with what you are using today in your cards. So thank you for your attention, and if you have any questions, don't hesitate. Thank you for listening.
Thank you, Romuald. There are no questions so far. They might come up later, and then please just use the chat or raise your hand. Otherwise, I will now give the floor to Cecile. It's all yours, Cecile.
Thank you. Do you hear me well?
Yes.
Okay, perfect. I will share my screen. Okay. And do you see the slides?
Yes, but not in presenter mode.
Yes, I'm trying to move. Okay.
Here you go. Correct now.
Okay.
Perfect.
Thank you. Thank you. Hello, everybody. As I mentioned, my name is Cecile, and I'm working as application specialist. So it means I'm there for the quality of results, and I'm here to help you to adapt some procedure, some software, so that you can get the best result as possible for your patients. So we are talking about EUCAST 2021. There are some slides I will go through because Romuald already explained them. First of all, we will see for the off-scale breakpoints. So the off-scale breakpoints are the breakpoints that are very, very low, and the breakpoints that we can't test. Even in other methods, it's really difficult to test as low breakpoints. Those breakpoints are coming from the EUCAST, of course. So I will not talk about the categories anymore. I think that Romuald was really clear on this. I just take an example, the most difficult example to show you how introduce or how to change breakpoints in your Vitek software. So I choose for cefuroxime IV. Why? Because this one, you have two different breakpoints depending on the way to give it to the patients. So we have off-scale breakpoint of 0.001 and 8. Okay, just to show you here, we in the EUCAST we are R is higher than. So it's really important in the EUCAST, on the EUCAST website, you will find the breakpoints with R bigger than, and in most of the Viteks they are programmed like R is higher or equal. So it means that the higher than 8 is the same as higher or equal to 4. So that is important, this difference when you introduce or you change breakpoints in your Vitek. This example, the cefuroxime EV. So when you are on the Vitek PC, and it's important that you are on the Vitek PC and not on a remote PC. So on the Vitek PC, you have the white icon with the Vitek 2. And when you click and you open it, you get one of the possibilities is the configuration view. The configuration view with the big arrow. You go to AES configuration because there we will configure the breakpoints. The screen that you will see on the left side, you will see the active AES parameter. Most of you will be in EUCAST plus EUCAST of global European base plus EUCAST or plus FANOTAP, depending how you work in the lab. In that parameter, you will find a tab breakpoints. You see that, the breakpoints on your left. When you click on it, you will get all the breakpoints you are working with. So what we have to do for cefuroxime, for example, we have to add or to adapt the breakpoint as a breakpoint for oral, and there is a breakpoint for IV. Okay, so you will make a breakpoint for other. So the other, you will add a breakpoint for other, and the breakpoint of urine for the oral you can keep. Why the infection site is other and urine? Because we don't have other possibilities. Okay, so this one you have two breakpoints for cefuroxime and Escherichia coli. Okay, you see that for the EV we make a bigger, higher than 8, and the off-scale breakpoint 0.001 we can't introduce, so we make it smaller or equal to 8 in the I column. So it means that you won't get any S result anymore. They all will be R or I. For the oral, there is still a breakpoint at 8, so this one we can keep. It's just for intravenous that we will keep another breakpoint. This is the most difficult one. The other ones will, for the off-scale breakpoints, will be easier because you won't have to add a new line. You can just click on the field and change the breakpoint immediately here. Yeah. What we advise you also to do is to add some advanced reporting tools. An advanced reporting tool will not change your result. It will just give you a remark as like more take attention for this or take attention for that. You go again in the configuration view, and in the configuration view, in the configuration view, you will choose for advanced reporting tool. Then the field will open and you will see the custom advanced reporting tool, local and predefined. We are working in a custom one. In the custom one, you will see some rules that were added by yourself or by bioMérieux. Some of them will be red. It means they are no active. Other ones are green, and of course, it means that they are active. When you add a rule, click on the sun, you will give a name to your rule. You will put it on enable or disabled. Enable, disabled means active or inactive. And then you're working like if a certain condition is available, then we will need some action. In this case, if we have an organism that is Enterobacteria C, and we have the cefuroxime smaller or equal to 8, okay? If this combination, Y combination, you see there is an end on the top. So if this combination disappears, what will be the action we have to take? The action is that it's stop for review, so it means it will not be validated automatically. The result will not be validated automatically. We add a comment this is an internal comment. So an internal comment means that you will see the comment on your results on the Vitek PC, but you will see also on the paper that you will print, but it will not be sent to the LIS. So if you want your remark to be sent to the LIS, you need to make an external comment. When you make an external comment, so you're sending something to the LIS, of course, it means that you have to program your LIS to get the information. And a third possibility to add is suppress for reporting. Suppress for reporting, you will see in the Vitek the result of cefuroxime, but it will not be reported to the LIS. Those are possibilities. Of course, you can choose one of them, two of them, all of them. You can add other actions that you want to implement in your lab. So always, if a certain condition is there, we want to have some action. This is an example of a result. So the first point I said, we will stop for review. So it means that you have to validate it manually. So this result is stop for review. The second action was internal comments. This is a free text, so you can add whatever you want. In this case, I put off-scale breakpoint for cefuroxime. So it will be visible on your results. The third point was suppress for reporting. So you see that the box is checked here. So it means that it will not be sent to the LIS. And then we have the fourth point. The fourth point, why? When you see this result, you see for cefuroxime, there are two results. There is one MIC because there is one measurement, but there are two interpretation because we have two breakpoints. So you have two possibilities. Are you say in advanced which breakpoint you want to use? So when you're introducing your card in the Vitek using FlexPrep or other possibilities, you can add the possibility breakpoint infection site. In the breakpoint infection site, you can choose for other or you can choose for urine in this case, and then only one of the two breakpoints will be taken in account. So it means in the result, you will see only one line. Another possibility is that you are working without infection site. So it means, like in the example, you see both lines, and depending how your LIS is programmed, you will only get one result in your LIS. So those are two possibilities that you can use to make a difference between the infection site. Be aware, if you want to use the infection site, you have to activate it in your general configuration. It's something easy to do. So if needed, just call us and we can help you to activate it. So I just want to show you, stop sharing and open another. I will show you another, sorry. Do you see the Excel file? No reaction.
Yes,
so
yes, we
okay.
do.
Thank you. Thank you. So this is just an Excel file I made. So it is wrote down, it's not validated. Why it's not validated? Because I'm the only one that checked this list. So if you want to use it, please have a second look to avoid forget some breakpoints. So this is an overview of the off-scale breakpoints. So you see it, all of them you have to change. There is only one you have to make, sorry. There is only one you have to make. Okay. This is an overview. You have the red ones here down. You don't have to adapt the red ones. I just put it on the list because you have done a complete list. Of course, the red ones are not available on the EST card of Vitek. Right? Do you see my presentation again?
No, still the Excel file.
Okay.
Now we do,
Yeah.
but not in presenter mode.
Okay, this is better.
Yes, perfect.
Okay, sorry, I'm not used with Zoom, so sorry for that. Okay, so this is for the off-scale breakpoints. So you have the list of the breakpoints you have to change. There is one you have to add, and then you can choose to work with breakpoint infection site or not. The second point is the ATU, the area of technical uncertainty. I just want to mention that it's not a new category. It's really important to understand this is not a new category, but this is something it's uncertain. Okay, so in the EUCAST, you will see also those MIC that are uncertain. There are not a lot of them, so it's okay. If you're working with diameters, you will have more adaptation to do. Those are the remarks Romuald already told us. So things that will explain you what you have to do when you have ATU. Depending on how you work in the lab, you will choose one of them, two or three of them, depending on your warrant. On the EUCAST, you will see, like I said, the ATU. In this, for example, we have ciprofloxacin with the 0.5 ATU. What we advise you to do is to make, again, an advanced reporting tool for those concentrations. So in the Vitek, you go to advanced reporting tools and you add a new rule. In this case, ATU Cipro 05 Enterobacteriaceae. So the organism are Enterobacteriaceae. You click again plus and you add a second line. Antibiotic is Cipro with the MIC of 0.5. So in this situation, we want a certain reaction. And the action in this case, for example, stop for review because you want to see it before send it to the LIS. You can add a free text what we have to do in the lab with these results. Of course, I put everything here, but you can just put one line or one information they have to do in the lab. And the third one I add here was report, a suppress for report. Again, you can choose whatever you want depending on your workflow in the lab. First one was here to be reviewed in this example. So you have to validate it manually. The second one was an advanced reporting tool message, an internal message to have a mention van attention. And here is the checkbox for suppress for reporting. Again, it's a choice. You can choose in your lab what you want to do depending on your work. Again, I have the list and I will stop sharing again and share again, but then the Excel file. And in Excel file, I had the second tab with the ATU. And as you can see, 1, 2, 3, 4, 5, 6. We have 6 ATUs to adapt or to change, to make, sorry, in your Vitek software. It's not a lot of work for this one. Okay. So this was all I have to say about these changes you can make. I just want to add some information. Sorry, I just want to go to the IIS. Where's my IIS? Sorry, this one. I just want to add because I had already the question, so I suppose you also need this information because you have to normally they ask to change the 1st of January. Of course, there are a lot of persons willing have holiday at the end of the year. So what you can do for now, you can already prepare the changes. How can you prepare them? The advanced reporting tool, you can make them or put them on inactive. You put them on red as for the 1st of January, for example, you just have to enable them. And for the AAS, what you can do is the active parameter you're using, you can copy it because it's not on here, but if you click on it, you can copy your active parameter with the changes you're already using, with the breakpoints you are using. And then you will have a second one parameter here. In this second one, you can already make the changes and still keep the first one active. So when you prepared already your new AES, the 1st of January, you can just switch your AES and it's ready to use. So you don't have to do all the work the 1st of January. This can also be used for validation. So if you want to validate your new AES configuration, when you make a copy and you add in the copy the changes, you can go back to results and to a recalculation on the new AES configuration to make a validation before the 1st of January. Those are questions I already got, so maybe can help you to prepare the changes you want to make the 1st of January. So are there some questions?
Yes, Cecile, I have a question from Torbjørn. He is asking, will Biomiljø distribute updated breakpoint tables that we can easily import? We are now updating on the same table year after year, and if mistakes are made, it could carry over, especially if we change the persons in charge of keeping these lists up to date. So basically the question is, will we distribute updated breakpoint tables that can be imported?
Okay, for the moment, I have to say no. But there are, in the past, there were several letters already sent with breakpoints that were validated, because we as Biomiljø can only advise you to change breakpoints that are validated by Biomiljø. Why? Because there is a lot of reaction in the software of the Vitek, and we have to check if the concentration are available on your cards. That's first one. And second one, what will be the reaction of the software on those breakpoints. So this validation was done for a lot of breakpoints until now, and those are the letters you're getting from the field, from the customer service with the breakpoints you can introduce. A second one is that we are working on a breakpoint list to give you an overview of breakpoints, but we are struggling with legal affair because we are not allowed to give a listed of breakpoints that are not validated physically. So this will be difficult. We have to discuss it still between in Biomiljø itself, what we can do for this. For the moment, we don't have it.
Maybe I can complement Cecile, if I may. You're right, this is today, as I said, part of the software. It's embedded in the software version that you receive. And as Cecile mentioned, if there is some changes to be done, it is manually in betweens. And we are conscious that, yes, it can be a source of errors and it can be not the optimal way to do. So we are investigating internally to have a breakpoint update only. And this is something that is investigated for the future, because it could be nice to have the importation, the automatic importation using remote access with the breakpoints table, validated one. Yeah.
Thank you.
They're not yet available.
There are no more questions so far, but I will leave it open for a couple of minutes just to see if someone might think about something. I have one question in the meantime. Cecile, the Excel file you shared, will you make it available for me, and then the participants can contact me if they would like to have it, or was it for you only, just for my understanding?
Tina, I will send you the presentation. I will send you the Excel file. I will give you both, of course, to share with everybody. But just I want to mention that it's not validated. So that's an important one.
Okay, thank you. So those of you who might want to have a copy of today's presentation and the Excel file, please reach out to me and I will send it to you. Still no more questions. So I guess you have both been very clear in your messages. If someone comes up with a question later on, then always please feel free to reach out to me, refer to this webinar, and I can see if it's a question for Romwell, Cecile, or for I, and we will of course answer those questions if they come up later on. Otherwise, I will just thank everybody for your participation today. I hope you like this webinar. You are more than welcome to come back to me with comments. We can always see if there's anything to improve for the future, or if you have any webinar topics in mind that you find that could be very interesting for a larger audience, please let me know and I will always investigate to see if it's possible. I wish all a splendid day. It's 11:05, so we are well in advance of our agenda. So you have some spare time. It's always appreciated, I know. So I wish you all a very nice day. Thank you.
Thank you.
So
Bye.